The Nova Scotia government won't say whether or not it's funding genital surgeries for teens.
Leaked emails show that the Liberal government has directed the RCMP to find $100 million in budget cuts.
Conservative MPs are pushing to pass a bill that will prohibit assisted suicide to those whose sole underlying condition is mental illness. Hello, Canada. It's Friday, July 11th, and this is the True North Daily Brief. I'm Cosmin, Dzsurdzsa.
And I'm Clayton, DeMaine.
We've got you covered with all the news you need to know. Let's discuss the top stories of the day and the True North exclusives you won't hear anywhere else. Nova Scotia's progressive conservative government is remaining silent on whether it's funding genital surgeries for teenagers, despite mounting evidence suggesting that the province is referring minors to Canada's largest transgender surgery clinic in Montreal. Freedom of Information records obtained by True North confirm that Nova Scotia's current policy allows youth to access irreversible medical treatments without comprehensive psychological assessments or parental consent. Nova Scotia's health insurance program has funded genital surgeries for minors, including at least 5 vaginoplasties performed on teenage patients under the age of 19. Additional procedures such as ovarectomies and penectomies were also authorized, though their exact number remains undisclosed. The province's progressive conservative government has not acknowledged the concerns raised by Canadian physicians. This spring, a group of doctors published a joint statement warning that affirmation-based care lacks sufficient evidence and may cause harm. Dr. Roy Apin, one of the signatories, said, quote, "It's shocking that the Nova Scotia government seems unaware of this data and is bringing more such questionable care to its citizens." True North reached out to Premier Tim Houston and Health Minister Michelle Thompson for comment. Neither office responded. The documents also outline a sweeping reform effort led by a network of activist clinicians, advocacy organizations, and political insiders. 2023, Nova Scotia Health and IWK Health implemented a revised care policy for transgender youth that replaced earlier assessment safeguards with a simplified informed consent model that allows minors to consent to life-changing procedures without parental involvement. Stacey Burgess, Executive Director of Clinical Care at Nova Scotia Health, confirmed in an email to True North that genital surgeries for minors continue to be approved and funded. This includes referrals to GRS Montreal, a private Quebec-based clinic led by Dr. Pierre Brassard. Nova Scotia's policies have been shaped by ideological alignment with the World Professional Association of Transgender Health, whose guidelines remove age minimums for surgeries and promote affirmation-first care. For a conservative government, this seems like a major issue that you would assume gets a lot of attention, but just going through the most recent election, at least, there hasn't really been any discussion within Nova Scotia politically about trans issues and the issue of minors being rushed into often without proper safeguards and guidance into these life-altering procedures. So, Clayton, is there a reason why Premier Houston and the progressive conservatives of Nova Scotia continue to fund these surgeries potentially for minors and teens?
Yeah, there's at least a couple of different explanations here, or at least possible explanations. One of those situations is where so-called conservatives go along with whatever progressive agendas are being pushed at the time. It's easier for a lukewarm conservative to go along with progressivism and position themselves in a more liberal province, especially as conservative, but as in, conservative, but I won't go after those sacred cows of the woke religion, or conservative, but I'm not like Danielle Smith in Alberta, for example. Houston even released an ad dogging on Pierre Poilievre, and the gist was essentially that, saying, I'm conservative, but I'm sensible and progressive. And I saw even liberal people who likely would never vote conservative, no matter what, applauding Houston for similar reasons, saying he's he's not like the other ones, and why can't all conservatives be like that? Um, but, pushing back against transgender treatments for minors, like Danielle Smith has done in Alberta, puts a target on one's back. And it's one of those pick your own battle moments for Houston, likely. It's also a possibility that the premier wasn't aware of these surgeries and has opted to shove his head in the sand, and avoid, stepping onto the stage to join in the battle on this, just playing it safe. A leaked internal email shows the federal government has directed the RCMP to identify nearly $100 million in annual savings as part of Prime Minister Mark Carney's cost-cutting initiative. The leaked email obtained by True North from a whistleblower informed members on Wednesday that due to federal government initiatives, the federal police force would have to reduce its estimated budget of over $6 billion by 2% annually for 3 years. RCMP Commissioner Mike DeMaine told RCMP members in the email, quote, "Given the alignment of our mandate to government priorities and recent investments, the RCMP will have a reduced savings target of 2%. For the RCMP, this means annual savings of $98 million, which will require difficult decisions that may have an impact on our workforce." According to the email, most government departments under the Liberals' comprehensive expenditure review are required to find 15% savings to their respective budgets over the next 3 years. The Department of National Defense was similarly asked to cut 2% from its over $35 billion annual budget, according to a Chief of Defense Staff memo released on Wednesday. The Department of National Defense cuts would amount to an estimated over $700 million a year over the next 3 years. The announcement noted that the cuts wouldn't affect Carney's recent funding pledges for the Canadian Armed Forces. Notably, Carney recently pledged to increase defense spending after Canada had missed the prior 2% of GDP target set by NATO for years. Now, Carney has committed to spending 5% of GDP on defense after NATO raised the spending goal. The cuts are part of the government's Responsible Government Spending Initiative, announced in the 2024 budget. Carney's Liberal government has yet to release a budget for this year, but claims it will be released by September. The internal RCMP letter noted that the RCMP was already proactively working towards reducing its spending through efficiencies. Still, it warned that important activities might need to be scrapped as the federal police organization seeks additional savings over the next few weeks. The letter set a comprehensive list of a finalized savings plan would be presented in the 2026 to 2027 Maine estimate, slated to be tabled by March 1st, 2026. So, Cosmin, we're hearing about across the country, especially since Trudeau has come into office, a rise in crime. It's still historically low compared to decades ago, but there is a lot of crime happening. There's a lot of new people in the country. Is reducing the National Police Service's budget a good idea?
So the Canadian government desperately needs cuts across the federal level. And I'm not one to say that any department, even policing, should be untouched. Because when you actually look at the things the RCMP has spent money on, I can point to at least $30 million that could be cut today as part of this, that were essentially useless funds that didn't actually go towards real policing activity. So the Canadian government desperately needs cuts across the federal level. And I'm not one to say that any department, even policing, should be untouched. Because when you actually look at the things the RCMP has spent money on, I can point to at least $30 million that could be cut today as part of this, that were essentially useless funds that didn't actually go towards real policing activity. So if the cuts target things like diversity, equity, inclusion initiatives, the useless spending that has gone into the gun ban and the buyback program, absolutely, those need to be made. And just to rewind a little bit, these things I'm mentioning were reported by True North. In 2023, it came out that the RCMP set aside over $15 million in taxpayer money to collect race-based data and study how they themselves, the National Police Force, are systemically racist. That's real, and that's still running until 2027. They're still spending that money. Let's maybe start there. Then there's also the gun grab, as I mentioned. True North also reported last year that the RCMP has already blown $13.4 million on the useless gun ban and buyback. And we all know that not a single gun has actually been retrieved by the federal government. And that program itself is set to cost, I think, like over $100 million. I can't remember the exact last estimate, but it's growing exponentially even. So that was last year, $13.4 million spent by the RCMP to not collect a single gun. And that figure is also likely much higher today. So, yeah, there are cuts to be made. And if the RCMP wants to be taken seriously, they need to stop acting like a social justice department and start focusing on police work. But I will add, if those cuts include actually depriving of RCMP officers of equipment, resources, or recruitment, that is a problem given the issues that Canada has seen with regards to crime across the country. The Conservatives want to amend the criminal code to prohibit assisted suicide in cases where the sole underlying condition is a mental illness via a private member's bill introduced to the House of Commons. Conservative MPs Tamara Jensen and Andrew Lawton held a press conference in Langley, BC on Wednesday to promote Jensen's new bill. Bill C-218, or the Right to Recover Act, was tabled on May 25th and aims to prevent the expansion of assisted suicide to the mentally ill. It passed through its first reading on June 20th and is set for a second reading in November. The bill, sponsored by Jensen and Lawton, seeks to restore a, quote, promise of care, recognizing the right of Canadians to receive mental health treatment rather than access to an assisted suicide program. The opening remarks made by Conservative MP Andrew Lawton, himself a suicide survivor, underscored the need to rethink the proposed expansion to the MAID program. Lawton, who seconded the bill, said he nearly ended his life by suicide 15 years ago, recalling waking from a coma after an overdose. Those concerns were reiterated by expert opinion contained in a press kit distributed at the Langley event on Wednesday. Dr. Dzsurdzsa Vrakas, a PhD psychologist and professor at Université du Québec à Trois-Rivières, similarly decried that, quote, if MAID had been available when I was at my lowest, I would have applied and I would not be here today. On Wednesday, while promoting the bill, Jensen noted that vulnerable people with mental health issues seeking help often face long delays and no reasonable access to support, which could lead to them seeking assisted suicide out of desperation. Under the proposed expansion to Canada's assisted suicide program, she's concerned that those individuals would be offered MAID instead of the mental health support they desperately need. Also present for the Wednesday presser were Graydon Nicholas, a former lieutenant governor of New Brunswick, former provincial court judge and First Nations advocate, and Alicia Duncan, an advocate and author on the subject of assisted suicide. Nicholas noted that suicide has become particularly commonplace on Indigenous reserves and that he opposed assisted suicide on both humanitarian and faith-based grounds. He pledged his support for the bill. With the Liberals dominating the House of Commons and potentially getting, that support from the NDP, the Bloc, etc., is this bill likely to pass?
I would wager it doesn't have much of a chance to pass, but it's one of those sending a message type bills. It sends that message that conservatives are not content with simply preventing the Liberal bill from passing that would allow the extension of MAID to people whose sole criterion for accessing euthanasia is mental illness. They're saying no, we should prevent it from ever happening and have it in the law to do so. Um, as discussed in the article, there's a long list of issues with allowing euthanasia for people with just mental illness being the sole reason for dying. Mental health is not like physical health. It's nearly impossible to tell if someone's mental state is going to be remediable. We don't know if someone's going to be depressed their whole life, or their life turns around and there is treatments, but it's not certain whether or not what treatments are going to work and to what degrees. And they also mental health could be an inhibitor of informed consent. Like, you could not really know, be able to make a proper conscious decision if you're in a state of poor mental health. And there's also a interesting thing where people can access these euthanasia programs with medical assistance in dying. They find it easier to get into a lineup to be euthanized than it is to access potentially life-affirming social services, but also experimental treatments. I've spoken to people, and this might not be a popular opinion amongst conservatives, but I've spoken with people who've accessed things like psilocybin as a treatment for end-of-life anxiety and the like. And I've been told that people can't even try these medicines that are admittedly experimental, but they could sign up to be killed, but they can't. They would have to go through electroshock therapy before accessing this medicine.
That's it for today, folks. Thanks for tuning in. You can stay on top of new episodes every weekday by subscribing to the Daily Brief on iTunes and Spotify. Also, while you're at it, make sure to hit us with a 5-star rating and please leave a review.